progress as a final bill, comes through the sausage-making process in the California legislature. However, as I said in my reply to them, we are asking them to lead. We don't want them to be followers. We want them to lead on this issue. So we appreciate their good thoughts and the fact that they're listening. We appreciate that our legislators are listening to us, but we want them to do more than listen. We want them to be the leaders that we elected them to be. So Steve and Monique, thank you for your kind thoughts. Let's get this going. Let's push this baby over the finish line, put it on the governor's desk, and let's pass AB 1400, Healthcare for All. It's called the Guaranteed Healthcare for All Act of 2021. And we want to thank our mayor, Kathy Murillo, who is here with us. Kathy can always be counted on to show up when the people are out in the streets, and we really appreciate you, Kathy. Kathy was instrumental in pushing the city council to pass a resolution of support last month for the concept of Medicare for All on the federal level as well as on the statewide level. And Kathy, if you'd like to say a few words, we invite you to address our gathering. Sure, be glad.
Thank you. Thank you, John. Thank you to the organizers for creating this event today, allowing us to show our support for the most fundamental of all human needs, accessible, affordable health care. Our voices today, the energy we are emanating from here right now, our support for single-payer health care is vital to making this happen in the state of California through AB 1400 or Medicare for All at the national level. Universal health care, a national health care system in Canada, started with one province. We can do the same here, starting with California. You think so? Yeah. I'm proud to announce that I have joined Mayors for Medicare for All, initiated by Long Beach Mayor Robert Garcia and Oakland Mayor Libby Shea. Our goal is to build support locally, one city at a time, leading up to a resolution and advocacy through the U.S. Conference of Mayors. And as John said, our Santa Barbara City Council did pass a resolution supporting Medicare for All. Thank you to the young woman here, thanking Megan Harmon, our council member, for supporting that. It was unanimous in our city council. You know, I put this on my social media, Mayors for Medicare for All, and somebody said, that's socialism.
That's a good thing.
And I was thinking, so you know, if your house catches fire and the firefighters come and put out the fire, you're okay with that kind of socialism. So it's okay for the government to pay for certain services, I believe. But we need to remove the profit-making equation out of healthcare.
Amen.
I've heard that from the people here today, and it's absolutely true. We take that value and we help that pay for AB 1400 and CalCare. And I want to close because I'm wearing my Planned Parenthood shirt, and I want to thank Planned Parenthood for providing healthcare services in the system that we are right now. Neighborhood clinics for low-income families.
Yeah.
Doctors Without Walls. They go into the parks and they help our unhoused neighbors. American Indian Health and Services. CenCal, I want to give them a shout out because they help people get Medi-Cal benefits. So we have kind of an imperfect system going on now. If we're lucky enough to have a job and an employer who gives us health care insurance, well, good for us. What about everybody else? What about the people of color? It's a racial issue, it's a class issue. You shouldn't have to depend on your employer or your own independent wealth to have good medical treatment. So until we get to single payer, everybody, support these groups, but don't give up. Some of us here believe that this will happen in our lifetime, but we have to keep up this kind of energy, this kind of advocacy, And let's get marching over to our assembly member. And we support him, and we voted for him, and we're going to help him pass this in the state legislature. Healthcare for all!
Kathy Murillo, yes sir. And you know, Kathy, many of us voted for you for assembly,
Well,
but we like Steve Bennett too. He's a good man.
Good man.
And keep in mind, folks, that even if you are the most self-interested of libertarians, and you're reticent about paying taxes for immigrants or illegal immigrants, so-called, undocumented immigrants, and you're worried about paying for them for health care. Guess what? If viruses and bacteria really don't care about the size of your stock portfolio. All they care about is getting in your body. And if anyone is sick, we're all at risk. So even if you're only concerned with yourself, think about it. We're all safer if everyone is covered. Because guess what? We're going to pay for it anyway in emergency room costs. So we're going to pay in higher hospital costs, higher taxation. So let's get it handled efficiently, once and for all, with one system to pay our wonderful medical providers, our dentists, our chiropractors, our acupuncturists, and so on, eye doctor, our dentists, and so on. Yep, and let's get the insurance companies out from between us and our medical providers.